Hello everybody, I'm Dr. Tanushree Pandey. I'm an obstetrician and gynecologist and also known as Gyne Guru on Instagram. And today we're going to talk about the very sensitive abortion pill. So what is the whole deal about the abortion pill? How do you take it? Is it safe? Till when can you take it? So let's jump into it. So basically, abortion pill or a medical termination of pregnancy kit, MTP kit, you must have commonly heard of it, is used in case when you don't want a pregnancy. Now, when is that? At times you ended up having unprotected sex and you realized much later that you're actually pregnant and you missed your period. Or sometimes it's just out of your free will. Sometimes it's not out of your free will. In all these circumstances, if you've been raped, you're a victim of incest, you're too young, you're recently married, and there are a plethora of reasons why you would not want that child. Now, in no way am I promoting or justifying abortion here. You need to understand when you take that abortion pill, the conception has already happened, meaning the process of the baby being made has already begun. There's just a few cells, but nevertheless it's an embryo, what we refer to as doctors, but it is still started. So no, it's not the egg or the sperm or the protection from pregnancy. It's rather a termination of pregnancy, something that has already happened. So of course the best is to use the right contraception, being aware, avoiding these pregnancies. But once they've happened, we cannot just let you loose like that and let you be and be like, no, we're not going to help you as doctors. So we as doctors are here. Now you need to understand that an abortion pill or the medical method is only safe up to a certain weeks. Now there are different guidelines, different countries that say different things, but up to 8 weeks generally is the target. So 8 weeks from the day you conceived, and that your sonography and your gynecologist will only be able to tell you exactly. So this is a rough estimate. So from the day you conceived, 8 weeks till that approximately, you can take the pill. Please do not fall for quacks and all these uneducated people, chemists who are trying to make a big buck out of the pill and just selling it to you like that. Please go to a proper gynecologist if you see 2 lines in your urine test, or if you think you're pregnant, your sonography shows you're pregnant, because the pregnancy can also be ectopic, meaning it's not inside the uterus but it's in the tubes or somewhere else. And if you end up consuming these pills, you can land up into serious trouble. Also, sometimes when you take these pills can lead to a lot of bleeding, a lot of pain. And for all of that, your gynecologist needs to be around you, needs to monitor everything and then only administer the pills. So now how do these pills really work? What they do is, they help you shedding the cell-staged embryo or the product of conception. I will not want to call it a fetus here because that will really affect the mentality and the thinking of a person, but it's a few stages, so it's a few cells and it's an embryo. So it basically helps to shed that away. Now this is your uterus, the embryo comes and gets attached here. The lining of that is the endometrium. So what these pills do is they shed off the endometrium and the lining of the uterus, which is normally also shed off in a period, and along with that, this embryo or this little product of conception comes off. Most of the time this is successful and you can avoid unnecessary surgery, which leads to further complications, pain, hospital stay, etc. But at times these pills can fail, wherein then surgical approach or a more operative approach will be needed, and your gynecologist will be able to suggest you the best. So if you've accidentally conceived, please rush to your doctor, because the more you delay it, and if it's crossed a certain size or the endometrium is thickened to an extent where it can lead to excessive bleeding, the medical abortion pill will not work. And in that case, you will have to go in for a surgical approach. So don't blame yourself, don't feel guilty, be careful, be cautious, but if it has happened, the abortion pill is safe, it is available in India, and we as gynecologists are legally allowed to do indicated abortions. So if it comes to that, the only person who can do an indicated abortion is a board certified MBBS doctor who's trained in MTPs or a gynecologist. So please go to a certified doctor. Don't take it in your own hands. Don't feel the guilt because it can be life-threatening. You can bleed to death if you don't take it properly. And always remember, you're not alone. We are here to help you out. Hope this was helpful. If it was, do go and follow Gynae Guru. Ask me any questions regarding abortion pills or abortion in general. I'm always here to answer your questions. Thank you.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.